It's common for people to experience changes in their mental health and well-being in the winter months for a multitude of reasons. Here today, sponsoring our segment and to explain what you might be experiencing are Kara and Kelsey from Gibson Area Health and Hospital. Thank you so much for being here.
Thank you for having us.
So I know you work in 2 different clinics that are similar. So can you tell us a little bit about both of them?
Yeah. You can start.
So I manage the Behavioral Wellness Clinic and also the Caring Connections program. So like Kara said, they're sister programs. Hers is more geared towards the 65 and older population, experienced citizens, as we like to call them.
Yes. I love that. I've never heard that before. Experienced citizens.
It's way better than geriatric or, you know, any of those terms.
100%.
And then my side at number 10, Doctors Park, is essentially anything underneath that, any age from 65 and under.
Okay.
So we just kind of split off into age ranges.
Yes, and both clinics address psychotherapy services and psychiatry services.
Okay, and I know something that is sort of coming up a lot in January is seasonal affective disorder. Can you talk a little bit about that, maybe what causes it and some ways that people can deal with it at home, but then also if they come to you?
So seasonal affective disorder, otherwise known as SAD, is a type of depression in which a person feels more of the depressed symptoms in the winter months. And it's thought to be affected a lot by sunlight and the changing patterns, our circadian rhythm getting interrupted, our tendency to isolate indoors in those months, which isn't necessarily a bad thing. We want to be warm and cozy, but then our social lives kind of get disconnected, and so those depression symptoms really creep in more.
And what is some advice you would give somebody at home who's maybe dealing with this? What are some things that they can do?
There's a multitude of things. So first of all, something I really like to use, which I don't have it plugged in right now, is a happy light or light therapy, which is essentially, they call it a light box that you would turn on and keep it around an arm's length away from you for about 30 minutes a day, and it's meant to simulate the sunlight. You can use it at your desk if you do a lot of work at a desk. You can set it on a bedside table when you're doing when you're having your morning coffee or something. It kind of tricks your brain into thinking, okay, we're enjoying the sunlight, and sunlight makes us happier.
Right.
Sticking to a routine, I think, is a big deal. Making sure that you're not, you know, completely isolating and straying from the things that you do in the summer months. And I know some of that is impossible to continue. I certainly don't want to hang out on my back patio right now, like I do in July. But definitely still getting up. If you're a morning showerer, stay taking your showers in the morning and stick with that routine. Don't try and stray too far away from that. Do your best not to isolate. Reach out to those that you know you can count on. Hey, even if I don't have the energy to get up and get out, would you want to come over for a cup of coffee? Would you want to come over and watch a movie? Just surrounding yourself with people that are positive makes a greater difference than you might think.
Absolutely. And I know that there's also a lot of stigma about mental health, and people maybe are afraid to call a clinic or come talk to somebody that they don't know. What would you say to sort of ease their mind as far as to make it less scary?
Please don't be scared to call. Like, it's so normal. It's so normal. I suffer from, you know, mental health struggles. I think everybody does. And honestly, most of the time on our side of things, I think we say to each other, I'm so proud of them. I'm so proud of them for reaching out. It's such a mature thing to be able to recognize and then make that call.
Absolutely. I would say compare it to any kind of physical ailment. I compare it a lot to diabetes, where it's kind of a chronic thing that sometimes it's managed really well and you're doing everything you need to be doing, and sometimes you get into this funk where things aren't going quite right. And you would never shame somebody for going to the doctor to address their blood sugar needs. We should not be shaming anyone for going to a therapist or a psychiatrist or even just their primary care doctor to address those needs.
Excellent. Well, you both seem really nice. So I think that anybody who calls is going to, you know, find somebody on the other end of that phone that can actually do a lot to help them.
Yeah,
so
absolutely. Please call.
We hope so.
Well, thank you both for being here and for sponsoring our segment. And if you need help or know somebody that needs help, you can go to our website, which is ciliving.tv.